and this is the second webinar this year for the Global Consortium. I think most of you know the consortium, but just to reiterate, it is intended as a global thought leadership forum and has been set up by VLife to assist organizations and are looking to improve the health and enhance performance of employees worldwide for competitive advantage. Today we have a full program, so two really highly interesting presentations. So I'll keep my introduction short, but I did want to mention up front the fourth annual survey on health promotion and workplace wellness strategies is now open. And I really encourage all of you, most of you I think know the survey because it's in its fourth year, but I'd like to encourage you to participate, and you can, if you haven't already received an invitation, you can access it at drsurveys.com. So now to today's focus, data privacy, an issue to consider in global health and well-being programming. I think we can say that data privacy is an issue anywhere in the world, but I think especially in Europe, where it's really heavily regulated and rigidly enforced, and that makes it also a challenge for health and wellness and for us in the field. You may have heard about some data abuse or even scandals. I know that one of our speakers will touch upon this briefly. That's been an issue and kind of has enhanced skepticism amongst employees of personalized health data and the like. And this is one of the issues, one of the main issues we'll address today. I should mention that VLife has become more entrenched in this as they recently won some business in the U.S., Europe, Middle East, and Asia, so they've had the need to address privacy and protecting and handling data as part of the tendering process. I thought I'd mention that. So for today's presentations, we'll follow a usual format. Today we'll have two around 15-minute presentations, and then we'll have some discussion. We'll have a brief Q&A, question and answer after each presentation, and then we'll go into the more general discussion, and feel free to chime in then at those times. So we have two really leading global employers presenting today. Nokia from Finland and Deutsche Bahn from Germany. As you know, they're both very large, both about 100,000 employees. Deutsche Bahn way above 200,000, so significant, but also in the area of health and well-being, they have been leading in countries or even globally. Therefore, I think we have a good program lined up, and I think not to waste more time, I'd like our first speaker to get going with this, which is Dr. Jan Čuk, and he is the Director of Global Occupational Health and Safety at Nokia, and he's based at the HQ in Espoo. So,
okay, thank you for your kind words, Wolf, and welcome to the call, everyone. I hope this will be interesting, and like I said, don't hesitate to ask questions. Like Wolf mentioned, my name is Jan Čuk. I'm head of our Global Occupational Health, Safety, and Well-being. We have been, let's say, going global, or at least trying to go global in the area of health promotion and well-being for the past about 4 years, and realized that is not one of the most easiest tasks in the world. Most of you probably know Nokia. We are the world leader in mobile telecommunications and also aim to be so in the future. We have a head office in Finland. We have strong R&D in about 16 countries, factories in 9 countries, and sales in over 160 countries. Like both mentioned, we have a bit more than 100,000 employees, 123,000 to be exact, including both Nokia and Siemens networks and Navtech, which we acquired a couple of years ago in the U.S. Out of this employee base, 47% are still based in Europe, with Finland being one, or basically the biggest Nokia country still, with about 22,000 Nokia employees. But right after that come already then countries like China and Asia that have very recently grown a lot. Most of our well-being efforts still focus on, how to say, more traditional countries, but we have opened the world also with well-being programs that have been launched in China, in India, also in countries where we haven't been traditionally so strong in this area. But the focus of my presentation will be mostly, well, I'll introduce our global programs, but then regarding data privacy, as that is, say, to some extent, a very European issue, or there are certain elements specific to Europe and to any given country. I'll focus on dealing with it on a Finland perspective. But before going into that, just a few words about well-being and how we see that at Nokia. And definitely we see it as more than just health and physical fitness. We have a well-being model that includes areas like physical well-being, mental, emotional well-being, professional well-being, social well-being. And we strongly feel that in order to really successfully promote well-being at work, all of these well-being elements need to be addressed. This is how our well-being model looks like. I guess the areas of physical well-being and mental emotional well-being are more or less known to all of you, but then we have also added the areas of professional well-being, where we really go into the content of work, about the meaningfulness of work, how rewarding it is, career opportunities, skills, competencies, definitely fields that are not handled by any occupational health, safety, well-being organization, but by the business itself. And this is strongly an area where we very strongly cooperate with HR. And then we have another area also out of the traditional health and safety well-being context, what we call social well-being, where we're talking about the values of the organization, ways of working, networking, diversity, social skills, and also the balance between work and private life, family, friends, so on. The elements of our global well-being program include several different items. One of the most key being management and leadership development, because we see that Nokia managers, in order to make this really fly, Nokia managers have to be role models in addressing both personal and organizational well-being. And we offer several solutions to support our managers in both managing their individual well-being, for example, a coaching on how to lead your own well-being intended or aimed at managers. And then we also facilitate sessions for teams based on the results of a well-being index, and I'll return to that, as that is dealing then directly with data privacy. I'll return to that later on. Then we develop our ways of working. We strongly aim at building a culture of trust and respect based on the results of our employee questionnaire, the so-called listening to you. We know that we definitely have issues there, as we have been facing some tough times. There have been a lot of restructurings in Nokia, so levels of trust aren't exactly the highest at the moment, especially in the R&D community, which has been treated pretty roughly by several major org changes. We have also launched early recognition and intervention programs, basically building on this working culture of trust, encouraging strongly employees to act if they notice that workplace rules are violated. And we want to ensure that issues are identified and acted upon as early as possible. We also have recognized that the environment we're working in, which is very global, very virtual, very distributed, with teams typically located all around the world, that we have to develop sustainable ways in order to really thrive in this environment. We also pay a lot of attention on dealing with health and well-being and change by launching programs based on needs, by developing people's skills in dealing with change, both regarding managers as well as individual employees, and providing peer support groups, and also personal counseling by the health services. We train people on well-being and stress management, offer webinars, trainings on the topic, and we have recently launched a well-being portal, a global portal, which offers reliable well-being related information for Nokia employees, and also some tools to assess their own health risks, and then again advice on how to reduce these identified risks. Employee assistance programs I won't talk much about, since that is pretty regular stuff for all of us, I guess. We offer comprehensive health services, although there are major country-level variations to what the content is, based basically on how health services in that given country are organized in general. The most comprehensive services I think we have probably in Finland, in Brazil, and then China is following pretty closely. And this means that there we can offer, in addition to preventive care or preventive activities and the traditional occupational health service, also actual medical services for our employees. And then we are also managing a wide variety of fitness services, running gyms, fitness classes, hobby clubs, and global and local fitness wellness elements. And we also this year launched a well-being community, which is open for all Nokia employees. It started with HR, but it's open basically for all Nokia employees who are interested in developing well-being, be it on personal level or on team level. And there we are sharing thoughts, ideas regarding this. It's been very successful in recruiting new people to work in this area, because it used to be too much, how should I say, professional driven, that we had health services professionals trying to manage it without true involvement from employees at a broader base. And I think that was a major, if not a showstopper, at least a major hindrance in really becoming successful in the area.
Yeah.
Then, yes.
Sorry to interrupt. Could I ask you to right-click on the area on the right saying Be Life Limited, and then click on Make Presenter?
Sorry, right-click on which area?
You have the participation people on your right.
Yep.
And you should have an icon there saying Be Life Limited. If you could right-click on that and say Make Host or Make Presenter.
Click. Doesn't happen anything.
If you
I don't see anything happening. If I right-click Be Life Limited Host, nothing happens.
Could you click on Host, please?
No, nothing happens.
Okay, you can continue.
Okay. Oh, by the way, I noticed I haven't turned this into full screen view. Should I do that?
It's not a problem.
You can see the slides, I hope.
Yes, you can.
Okay,
Yeah.
good. Okay, then back to data privacy. So at Nokia we have a strict global privacy guideline. We observe high standards of honesty, integrity, and ethical conduct regarding our data processing practices. We try to, we are as open as possible and transparent about our data processing practices. So basically people should know where the data is, where it's archived, have access to the stored data, and it should be clear to them when their personal data is stored by Nokia. Obviously, there is no disclosure of data without permission or clear legal requirements to do so. And if we use third parties to process data, both technical security, meaning IT solutions, etc., and the physical security of the data, meaning location of servers, etc., are audited and assured. And we obviously also recognize the limitations to transferring personal data across borders and respect those. How we then collect data on employees regarding their well-being or occupational well-being. Well, I mentioned already we have the Listening to You employee opinion survey, where we have a social well-being index and a physical well-being index, like with including statements like the stress level at work is reasonable, or my manager supports my efforts to balance my work and personal life. Here, obviously, no individual results are reported, and on team level results are reported only if more than 5 responses from a team have been received. And this questionnaire is global. We have had a very great response rate, with about 83–86% of our global employee base responding to the questionnaire, and really high levels of trust regarding the integrity how this questionnaire is managed. Then in Finland, we're utilizing something more personal and directly health risk related. We use a health risk appraisal called SANTE. It includes sections on, for example, depression, well-being at work, perceived working ability, and the results are reported both for the individual. They receive a red, yellow, green type of a scaling on their risk levels, and occupational health services have view to all the results, all the personal results, unless of course the individuals have declined that view from the on the occupational health or for the occupational health services. So their occupational health care or medical professionals working in our occupational health services have access to the individual results. But obviously only summarized results are again provided for HR and management. But we aim to call all the reds, the high-risk people, to have a real physical health examination and meet with our occupational, one of our occupational health physicians. So there, then these people have, like I said, direct access to the results, also to the responses to individual questionnaires regarding the health risk phase. But like I said, that is always based on individual consent, prior consent, written consent by the employee's personnel. Last year, we started to use a well-being index, which is basically a well-being questionnaire designed for Nokia by certain university researchers. Basically, the questions have been validated and are familiar from many previous questionnaires, but the combination of these has been designed for Nokia, specifically taking into account our challenges, which I was already discussing earlier on, virtual environment and so on. And there, in this well-being index, again, the individual result is visible only to the respondents. No one else can see it, and again, team-level results are reported only if you have more than 5 respondents from a team here. And as always, the individuals participating give their or agree with the terms of the questionnaire when participating. Then we perform also some targeted well-being questionnaires. These are always performed by occupational health services personnel based on demand by organizations. Again, no access to individual results, only group level results are reported. Then we've also made recently an interesting approach on something we call health due diligence, in which we do a analysis on costs related to disability, typically long-term illness, disability pensions, also occupational accidents and disability related to those, as well as the cost of occupational health services, to have a good understanding what our performance is regarding the management of disability-related costs and what the related costs are. There we have actually been facing some privacy issues because had to go to our Ministry of Health to really check that the method is foolproof when it comes to data privacy, because in order to develop statistics based on age and gender, we have to give this third party the identity number of individual patients. And in Finland, we manage, our occupational health services has a patient database, which is managed by Nokia. So basically, we have an internal patient database. And in order to run the health due diligence, we have to give to that, or the third party has to analyze a major part of information embedded in the patient database. Now here I have probably to mention that the legislation in Finland is more open towards what the employer can know about, for example, the reasons of absence of individual employees. Based on the Finnish legislation on privacy and data protection in work life, the employer has the right to know the diagnosis of any absence from work due to illness. So this is probably not, or as far as I know, it's not very common, not in Europe and not in the world in general. So this allows some handling of information that is typically not available for employers or representatives of employers in countries or companies. Okay, that is what I had in mind for my 15 minutes.
Great, thanks, Jan. That was really, really interesting. Let's take a couple of questions. I have one here from a participant asking about the typical question always comes: what is your participation rate for your HRA?
It has been between 60 and 70%. Pretty good. Could be better, but still pretty good.
Okay, very good, very good. And let me ask you just a quick follow-up. Do you use any incentives, or how do you get that kind of participation rate?
No, we don't use any other incentives than what the person themselves. I mean, they get the report on their personal health risks. That's the only incentive we use. But we have tried to market it as well, make it as attractive as possible, and also approach the employees. Well, we repeat the message if they don't answer immediately, and repeat actually twice. But that's all we use.
Okay, thanks. Let's see. Let's take one more question. Barry, Muna raised her hand. Was that the question, or is that a different one? Do you know?
It is a question. I'll unmute her 1 second. Go ahead, Muna.
Muna, you want to go ahead? You're unmuted. Can you hear us? Okay.
No response.
No response. Okay. Okay. Let me ask. Anybody else have a question at this point? Otherwise, we'll move on to the second presentation.
I think maybe Michael Doden has. Michael, do you have a question? His question is, what countries is the HRA used in?
Currently, this HRA is only used in Finland. It's available or has been translated to be used in several countries, but so far we have been using it since the year 2005 and only in Finland. Considering going global as the company has the readiness for that, they now also have an operation in the Netherlands, in Europe, and then they have run the questionnaire on Europe level for several other companies. We are using other HRAs in the US, but there it's managed externally by our insurance company, and equally then health service providers are using their local HRAs, but that is totally managed, totally by them, and Nokia internal occupational health services only get the information or the statistical reports, but aren't participating in forming those assessments.
Excellent. Thanks, Jan. So just stay on with us. There may be some more questions. Let's move on. I know that we're kind of close to the half hour here. So I would like to ask Dr. Christian Gravat from Deutsche Bahn. You may know that's the German national railway company. A private employer, by the way, and one of the largest companies in Germany. And Christian is the director of health and social policy at Deutsche Bahn, and he's based here in Berlin. So, could we start with the presentation upload? Well, I guess it's uploaded. So, Christian, why don't you go ahead?
Yes, thank you, Wolf. I hope anyone can see my presentation already on the screen.
Very nicely.
You have it on the screen. Very nice, yes. As for Nokia and for Jan, of course, health and safety are also for us of big importance, not only for well-being, but of course also for safety reasons. And I would like to share with you a little bit what we may have experiences around safety and protection of health data. But Wolfert asked me before to tell you a little bit about Deutsche Bahn again in general, and about our health promotion programs before I get to the data privacy issues. So let me just do this first. As Wolf already said, we are the national German railway corporation, the biggest provider. There is a privatized railway market in Germany. There are a couple of hundred providers, but we are by far the biggest. We have about 240,000 employees, about 200,000 in Germany, and we have three big markets. We transporting people, so that means running railways, but also providing the infrastructure for railway and logistics. Divisionka and Formel Bags in US are also parts of Deutsche Bahn, and Arriva in Great Britain will also become part of our company very soon. So one of our biggest challenges is that we have a rapidly growing workforce. At the moment, the average age is around 44, and it will be very soon around 50. Already 1/3 of our workers is beyond the age of 50, which means for a very operational company working hard and working in shift and night shift, that's really a challenge. And this means for us that we have really to take care of health promotion and any kind of health promotion programs. This leads me directly to our health promotion programs. Very briefly again, you see our demographic change challenges, a lot of consequences for HR management. I said already, average age of the workforce is increasing rapidly. This means for us really strengthen workability and employability. Of course, workability in the job right now and employability for future jobs, but also balancing the age structure as well as possible. Of course, it means increasing sickness rates. We say about 0.1% per year, and we set up effective health promotion programs, but that will not stop totally this effect, and we have to promote individual responsibility for health and lifestyle, but it's very difficult to change lifestyle habits in over 50-year-old workers. They have an expectance of other solutions. And of course, it increases the rate of handicap very fast, also this high average age. So we offer programs, and we have some special chances for lifestyle intervention at Deutsche Bahn. As you see, when we measure our risk factors, most of our workers have 2 or even 3 risk factors, and the chances are that we really have long-term employment. In general, people stay lifelong in our company and have high loyalty, which gives us a lot of time and long-term effects on health promotion programs. But we have frequent shifts and night work for elderly as well as for the young. We have, of course, working in isolation, single-man workplaces. There is often time pressure, climatic exposure in construction, on bridges, wherever. And we have, which is advantage again, continuous high demand of qualified personnel. We are not in downsizing anymore, but we're a growing company, which gives a lot of new opportunities for our workers. And on the backside, again, we have high aptitude standards, so a lot of people lose their workability in their jobs and have to be moved in other jobs with less medical standards. And overall, it means, same as in most of your companies, we really need a strategic approach towards health promotion. We have to strengthen the role of first-line management. It's always a challenge to reach all employees and not those interested in health promotion. Hello?
Keep going, I can hear you.
You hear me? Okay, I lost contact. I'm sorry. You have to reach all employees, as I said, which is always a challenge, not only to reach the young and healthy employees. Change of attitude must be sustainable, and we are really doing a good job in integrating health promotion in main structures and processes of the enterprise, so in regular HR processes, whatever. But on the backside, then you get resistance, and of course, resistance leads to public reaction and other things. So, you still hear me? Hello?
Yes. Yep.
Yeah, I'm sorry.
Other people are just joining and calling in, so just disregard.
Okay. Yeah, okay. So, I just briefly show this slide. I don't want to present as many companies. We have an entire health world of DP with a lot of different measures and programs, a large portfolio to bring all, address all motivational stages and topics in health promotion. But coming now to data privacy in our issues, I said already that might lead to resistance, that might lead to discussions. And in 2009, in Germany, we had in general, not only in Deutsche Bahn, a quite big media campaign around privacy of personal data in the employment. And there were a lot of headlines. Deutsche Bahn was there mainly not for health issues, but for compliance issues. But nevertheless, Daimler, for instance, had some bigger health data scandals, and our discounter, Lidl, big supermarket chain, was said that they illegally keep records of employee health data. Someone found papers and forms containing Lidl employee health data in a trash bin at a car wash and forwarded it to our German magazine Spiegel. And Lidl was really found to violate data protection law in many cases. With Deutsche Bahn, it was more that the problem that we were accused to spy on our own employees, including many top managers trying to uncover corporate corruption. And by that, we have compared basic personal details like bank account numbers of our employees with the details of our external suppliers in search of irregularities that might suggest internal corruption. And at the end, our CEO and some other top managers, let me tell most of them, had to leave the company, and all personal data handling was put under special attention, and so my health data also came under very special attention. What findings were really that in the end? That was not very much. All our companies were checked regarding individual health data protection, and in 3 companies out of 500, we found illegal Excel sheets containing names of employees in conjunction with diagnoses or similar confidential health data, where people not only had made lists of the knowledge they had from the employees, which might be fine if that is your personal file, but that they had put that in some kind of data sheets in the computer network. What we found more often was that we had documents with confidential medical data in our personal files, even if they should not be there. For instance, doctor certificates that contain diagnoses or other medical records. Very often the employees themselves had delivered them to the employer, and they were not taken out of the records after they were not necessary anymore. So what we had to do, we did a complete screening of all our personal files of 200,000 employees, and we removed or blackened all diagnoses in these personal files. We had an information campaign and training of all leadership and HR staff, and we had to implement a lot of new processes in the exchange and storing of electronic files containing confident personal data. Just to remember that is not a typical German idea, but that we have a common Charter of Fundamental Rights in the European Union, in Article 8, number 2, it said that data must be processed fairly for specified purposes and on the basis of the consent of the person concerned or some other legitimate basis laid down by law. And this is very important, that it has to be done by law. Not every regulation is valid. People must have the chance to go to court against any kind of regulations when they feel that this is against their personal data protection. And this is the same for European Union in all countries. Of course, there are national laws behind that clarify that further. So, taking out of a lot of the principles, I would like focus 3 principles which must be always followed in processing personal data, especially in health data at the employer: legitimacy, purpose, and necessity. And I will just go them through. The legal basis for handling health data or personal data can, of course, be a law. Here are some German laws, but it can be any kind of laws for infection control or other things, but that's fine. And it can be employer work council agreement. But what is new, for instance, especially at DB now, that we say consent of a person concerned alone is not sufficient anymore, because that is an imbalance of power between the employer and the employer, and so the work council has to approve the particular process, data processing, and then only then the consent of a person in processing his personal data is valid in the relation employer and employee. The next thing is purpose. Before you process personal data of employees, you must always clearly state what is the purpose of processing, and the purpose must obey legal regulations and the personal rights of the person concerned. That means if we do a health risk appraisal and we collect data as an employer, we must know what we want to do with this data, and we must do that before. And we cannot just collect data because it might be nice to have them in 5 or 10 years. And any processing of personal data of employees beyond legal regulation is forbidden. So the end does not justify the means. And this is quite often a little bit difficult because you feel that you might, or that you want data, or you need to collect data, but then really to tell the purpose and make the purpose public is not always very easy. And our German Federal Constitutional Court is there very clear: data preservation, so collecting data which you do not need at the moment or where you do not know why you collect them, is not possible, or is not allowed. And the next thing, which is very close to that, is necessity. So before you collect data, you must always ask yourself, do I really need the data? Do I need these data really in the requested extent? So not just because it's nice or you would like to have them, that's not sufficient, but it must be really necessary. And also, as I mentioned, when I don't need these data anymore because, for instance, medical examination has fulfilled its purpose, I should not process or store them anymore, but then I should take them out of the personal file. Having data only for the time I need them, only processing actual necessary data. It must be always proportional to the purpose. If possible, this is new now in our German law, personal health data must be de-identified, so I need numbers instead of names in connection with my data, and especially the length of storage. So in general, we say as an employer we should not keep health data longer than 3 years, because there is no purpose at the employer to have them longer than 3 years. And the doctors, of course, they must keep their medical files for at least 10 years. And that is something different. Yes. May we still talk to our employees? Oh, I'm sorry, this is a little bit destroyed, this file now, but Of course, leadership and health belong very close together, and if I want to have health promotion, I must talk to my employees about health matters. And everything is allowed in a very personal, for I view, discussion, as long as I don't make any documentation on that. So if a patient or an employer wants to talk about his cancer or whatever with his employer, that's just fine, as long as that does not end up in the personal files. But besides that, there are some very certain rights. Of course, the employer has an obligation to organize his business, so he always may ask how long an employee will be probably leave from work due to sickness, or he can require any kind of certificates for that. In our company, for safety reasons, of course, we may ask whether there are medical facts which lead to serious doubts about attitude or work capability. Then we can, of course, offer any kind of health promotion, health management, and can talk in this way to him. But we may not ask for medical diagnoses or medical causes of diseases and disabilities. And in the meantime, after fighting this for a couple of months, I understand that that is a very sensible clarification, because a medical diagnosis is very helpful for a doctor or for medical professionals, but for non-medical persons or employers, diagnoses are linked to a lot of wrong ideas and a lot of misunderstandings, and so medical diagnoses are indeed not very helpful. A heart infarction can be everything from work capable from the next day on until to disability, and the same with a lot of other diagnoses like cancer or whatever. So we say now we have on one side we have confidential health data. Of course, they can be handled by the employer with appropriate confidentiality. And we have diagnoses and medical findings, and they should not be handled by the employer. They belong to the medical officers and their medical files. In summary, data privacy in Europe, a barrier to employee health and well-being. Well, I would say not in general, but of course it is a barrier to detailed information exchange between employer and sickness funds. Often we would like to exchange some more information there. It's of course an obstacle to using health risk appraisals for the purposes of the employer. It can be an obstacle in occupational health. It's difficult if our occupational health specialists want to talk to hospitals or primary care physicians. There we need always the personal consent of the employees, of course. But on the other hand, I think it's a chance to promote individual responsibility for health and lifestyle. And of course, and that's very important at the moment in our situation at Deutsche Bahn, it's a commitment to personal rights of our employees. Thank you very much.
Great. Thanks so much, Christian. Very interesting information, and thanks for giving us a good update on the real legal basis for all of this. Let's go right into questions. I have one here which is pretty interesting. How does Deutsche Bahn handle cases where employee data privacy has been breached? Is this ground for termination?
I'm not sure whether I understood where employees have breached that.
Yes. Oh, yeah. Any employee who may be in charge of handling data, if this has been breached or abused, is it grounds for termination of a certain job, I guess. That's how I understand it.
Yeah, we have terminated a couple of work contracts for higher leadership, but because they set up wrong incentives and wrong systems. I'm not aware that we have terminated a work contract at the moment just for breaching data privacy in single cases, because we have not made this rule this clear as now. But in future, of course, that will be or could be a reason for termination if this is offended especially not if it's not done by mistake, but really by system.
Okay, good. Barry, I see your hand raised. Do you have a question?
It's not me. I'm actually the host one. I believe that someone else has logged in as VLab Limited. So
okay. I thought that you may have wanted to communicate for me. Anybody else have a question for Christian?
This is Jan here again. Sorry.
Go ahead. Sure. Go ahead, Jan.
Yeah. It was interesting to hear. I mean, obviously we have some operations in Germany, and I know that the German regulations are among the tightest in Europe when it comes to data privacy. But it's interesting to see the difference here again between these two countries, I mean Finland and Germany within the European Union. In Finland, the employer is by law entitled to handle information such as the diagnosis, or basically the reason of the absence due to illness, both to decide whether, for example, a compensation on the absence should be paid based on the contract of employment, and then again whether the reason for the absence for work is valid, because we obviously know that medical professionals, especially if they're not talking about occupational health services, they do not necessarily have that much information on the actual content of the work of the person, or they are totally relying on the information they receive from the patient. And unfortunately, this information might at times be biased. So in that sense, I think it's, and of course, the employers have to be very, take their responsibility seriously here and not abuse the information. But in that sense, it's a very valuable basis for discussions around working ability and what can be done regarding the work if the employer has that information. Now, last week I had visitors here from the Netherlands, that they pointed out that if there is a relationship, a trusting relationship between the employer and the employee, that discussion can be had without the medical certificate, which is obviously true. But sometimes, I mean, in Finland we have been living with this situation for a while, and I guess both employers and employees are so used to it that it isn't really a major concern here anymore. But just to say that you can deal with the topic both ways, with having the information, and obviously you can also do a good job without having the information on the individual reasons of the absence from work.
Thanks, Jan. Interesting differences between Finland, Germany, and the Netherlands. I think that's really important.
Yes. If I just may comment a little bit on that, because we have both systems in our country. For public service, it's still very much that model that government about its own employees has pretty clear picture about their health. And we having been a public company and public service up to 1994, are still in a kind of a migration. And a lot of leadership still has the expectation that we have the same rights towards our employees as government has its own public servants. And that's part of the problem, I guess, that we must understand that in a regular employership, there are different rules than in public service, especially in Germany. But I guess we are in a good way, and I have tried a couple of years to reduce sickness rates by doubting medical certificates, but I don't think anymore that is a good way. I guess if an employee or worker or so is believing that he's sick, no doctor can show him the opposite. So at the end, the patient or the worker decides himself whether he is able to work or not. And it doesn't make any difference whether the family physician or the specialist or the occupational health doctor or someone else is filling out the medical certificate.
Okay, interesting. Thank you, Kristen. I think we have a number of questions, and I know we're running out of time slowly. I think Rick, are you there, or Barry? Can you unmute him? I think he had a question.
He does have a question, yes. I'm going to have to unmute the list, so bear with me for 1 second.
Sure, no problem.
Can you hear me now, Wolf?
Yeah, I can hear you. Go ahead.
Oh, great. To everyone on the line, firstly, many thanks to Jan and Christian for 2 fantastic presentations. My role as Head of Global Distribution of V-Life means that we want to try and provide organisations around the world with some thought leadership and some stimulating debates on health and well-being across the globe, and these 2 presentations have been fantastic, and so thank you very much indeed for that. I particularly liked Christian's piece about leadership and health go hand in hand, and I particularly like the idea of this integration into the whole business, but also the individual responsibility having to be core to any health program, that the leadership can provide it, it can be integrated into the other services, whether you call it a health world or whatever, but ultimately you've got to get the culture right in the business to get the individuals to drive their own responsibilities. And I think it's very important when you consider the protection of data across the UK, whether it's the Data Protection Act or the data protection in America with the HIPAA Act, which relates to health information within health plans, or indeed, as Christian mentioned, the Fundamental Rights Charter and Article 8. It's very important that these legal requirements are met, but they should not be seen as a blocker, because ultimately we're all here to try and improve the health and the well-being of the people that report to us or work with us. And they're not there to be a blocker, they're there to make sure that we comply with the regulations. And by listening to Christian and to Jan, it's obviously clear how we can work together. So thanks again.
Thanks, Rick. On that note, there was a question about if there is a unified tool to track metrics globally in a consistent way, or do you need to use a different tool in every country? I think you already answered that. I think probably it is an HRA to be used. While at the same time, of course, being aware of the data privacy legislation, but
and absolutely right. The V-Life solution, which is a global HRA, which is culturally adapted to locations around the globe and translated, complies to all the regulations within that particular territory. But we go and seek the legal support and the documentations within that particular territory. So there is one. It's called V-Life, but obviously individuals need to make up their mind which one they'd like to select to improve the health and well-being of their population.
Sure. Yeah. Let me have another question here to the speakers. And again, it's about the HRA, and the question is the HRA, the Health Risk Appraisal, considered a medical tracking or diagnosis tool falling under greater scrutiny? So is the HRA considered a medical tracking or diagnosis tool falling under greater scrutiny? Either Jan or Christian, you try and take a shot at that?
Well, if I take this is Jan, if I take a shot first, the HRA we are using is not considered to be part of the patient's data or medical records. So it's a separate record and not treated as patient data.
Well, for us, it would be very important who is running that HRA. If that is done by the medical service or by an external provider, and it's not mandatory to the workforce, then it's no problem at all. But if it's an instrument of the employer, it has to undergo the rules of purpose, necessity, and so, and then we must show why we need this data as an employer. And so I see for the moment no chance to introduce an official HRA as an employer at all, but we can only offer external opportunities, external tools. Besides that, of course, we have a workforce where half of them are not used to work on computers. So it will often in the fields where it's most interesting for us as an employer to see the health status of our workforce, it would not be representative for the workforce, for the entire workforce, because we would only always have appraisals from the healthy and young and computer fit employees.
Indeed.
Just to clarify, the health risk data that you listed, Christian, that was part of a research project, correct? That was a one-time research project from a university?
Yeah, and they were just gathered very regular by medical examinations.
Okay, I see. All right, well, I think, let's see if any last-minute questions, because I think we're already pretty much at the end of our time. I just wanted to mention, as you can probably see on your screen, the next one, which I think, again, touches a really interesting issue, and the whole issue of mental well-being or the psychologically healthy company. And a lot of you may know Carrie Cooper in the UK. He's been very, very much leading research in this area. So anyway, that's our next webinar on the 13th of July. And so I'd like to thank you for participating. It's been really good, and a really good interaction, especially the presenters for their very useful presentation. So hopefully see you or talk to you in July. And as always, please provide your feedback on topics or regional regions. Always welcome. Thanks a lot, and we'll talk to you soon. Bye.
Thank you.
Thank you. Bye-bye.